Part A. Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Ms. Mihiraa. How are you today?
I'm still not feeling great, nurse. I've been experiencing these symptoms for a while now, and they're really starting to affect my day-to-day life. My face feels stiff, especially on the right side. It's like I've lost control of the muscles there, and I can't close my right eye properly. It's very uncomfortable and even a bit scary. Eating is difficult because my mouth droops slightly on one side, and I'm drooling without even noticing. Speaking has become challenging too, and people have trouble understanding what I say.
I understand that must be frustrating. How long have you been experiencing these symptoms?
It started about a week ago. At first, I thought it might just be stress, but it's not going away. In fact, it seems to be getting worse. I thought it might be a stroke, but I don't have any weakness in my arms or legs. And I've noticed no changes in my thinking or memory.
From what you're describing, it does sound like it could be something other than a stroke. Based on facial muscle weakness, difficulty closing one eye, and the fact that these symptoms develop suddenly, it might be Bell's palsy.
I've heard of that, but I really don't think it's that serious. I mean, I don't have any severe pain or fever, just drooping and difficulty talking. Can it really be painless?
Yes, it doesn't always come with pain, although some patients do report discomfort. It's a condition where the facial nerve becomes inflamed, and this affects the muscles on one side of your face. It's usually temporary, but it's important to get it checked early. Have you been on any medication recently, or any other significant medical issues in the past?
I take antihistamines for my allergies, but that's about it. I've been on cetirizine for maybe 2 years now. I don't know of any chronic conditions. Although, I did have a bout of sinusitis a few months ago, that cleared up with antibiotics. Other than that, I'm generally healthy.
Thank you for sharing that. Do you have a family history of any neurological or autoimmune conditions?
Not that I know of. My parents are relatively healthy, and so are my siblings. My father has high blood pressure, and my mother has diabetes, but nothing related to nerve issues or anything like that.
All right, good to know. Have you tried any treatments for your current symptoms? Anything over the counter, or perhaps home remedies?
I've been taking ibuprofen because I thought it might help with the swelling or inflammation, but it hasn't done much. I also tried using warm compresses on my face to relax the muscles, but that didn't work either. Other than that, I've just been hoping it would go away on its own.
It sounds like you've done what you could. Based on your symptoms and what you've told me, I'd recommend doing a few medical tests to confirm the condition. We'll likely do a physical examination, and I'll refer you for an MRI scan to rule out other possible causes like a tumor or stroke, even though it seems less likely.
Do you think the tests are really necessary?
It's always better to be thorough. The condition usually resolves in a few weeks to months, but early treatment is important, especially if we can confirm the diagnosis. Steroids like prednisone are often used to reduce inflammation, and antiviral medications might be prescribed if there's suspicion of a viral cause.
I'm not sure about that. Aren't there a lot of side effects?
Yes, steroids can have side effects, but they're usually short-term. If you start treatment early, it can really help with your recovery. The main goal is to reduce nerve inflammation and improve your muscle function before the condition worsens. We can discuss the details of the treatment plan once we get the test results.
Alright, I suppose that makes sense. I'll do the tests.
Great, I'll schedule you for the tests as soon as possible. In the meantime, keep doing the facial exercises I'll show you, they can help maintain muscle tone.
Thank you for your help.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good afternoon, Mihiraa. I understand you're here due to some throat-related issues. Could you tell me more about your condition?
Good afternoon. Yes, for the past 3 or 4 days, I've had a sore throat. It started off as mild irritation, but now it's become quite painful. I'm also finding it hard to speak.
I see. How would you describe the discomfort? Is it more of a sharp pain, or is it more like a scratchy, dry feeling?
It started as a scratchy throat, but now it feels more like a burning sensation. I also feel hoarse, like my voice is weaker and sometimes I can't speak clearly at all. My throat feels dry no matter how much water I drink. I've tried to rest my voice, but it's not helping much.
That sounds uncomfortable. Are you experiencing any other symptoms?
Yes, I've had a bit of a cough, though it's not constant. Swallowing has become quite painful too, especially when eating. And I've noticed a mild fever since yesterday, but nothing too severe.
Okay, and how has this been affecting your daily activities?
It's been tough. I'm a teacher, so I need to talk all day. But with this pain and the hoarseness, I've had to take some time off. I can barely get through a conversation without my voice breaking. Plus, the fatigue from the fever is making it difficult to concentrate.
I can imagine it's quite distressing, especially with your job requiring so much vocal work. Let's talk a bit more about your health background. Have you had any previous issues with your throat or voice, perhaps something like laryngitis?
Nothing like this before. I've had the occasional sore throat with a cold, but nothing this bad.
What about your family history? Any conditions that run in the family, like throat issues, allergies, or respiratory conditions?
Well, my mother had asthma, but none of us kids inherited it. My father, though, did have scarlet fever when he was young, but he recovered without any lasting issues.
Thank you, that's helpful. Based on what you've told me, I initially suspected laryngitis, which is an inflammation, usually caused by overuse, irritation, or infection. But considering your other symptoms, especially the fever and painful swallowing, I'd like to investigate further. It could potentially be scarlet fever.
I thought that was a childhood illness.
It is more common in children, but adults can contract it as well, especially if it develops as a complication from a throat infection like strep throat. The signs, such as a sore throat, fever, and sometimes a rash, can overlap with what you're experiencing.
So how can we be sure?
To confirm the diagnosis, we'll need to do a few tests. First, I'll do a physical examination of your throat and look for any signs of redness or swelling. Then, I'll take a throat swab to check for a bacterial infection. We might also do a blood test to look for any markers of infection.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a doctor called Mihiraa talking to a patient. Now read the question.
Mr. Harry, I've reviewed your X-ray results and there are some concerning findings. We're seeing evidence of a fracture in your left wrist.
Oh no, I didn't think it was that bad. It's just a bit sore, Dr. Mihiraa.
While the pain might not be severe, fractures can be serious. We'll need to confirm the type of fracture and determine the best course of treatment.
What are the treatment options?
Depending on the type of fracture, we might consider casting, splinting, or surgery. We'll need to assess the severity of the fracture and your overall health before making a decision.
Will I need to have surgery, Dr. Mihiraa? I'm worried about the recovery time.
That's a common concern. Surgery might be necessary in some cases, but it will depend on the specific type of fracture. We'll discuss the risks and benefits of each option and develop a treatment plan that's right for you. That's a common concern. Surgery might be necessary in some cases, but it will depend on the specific type of fracture. We'll discuss the risks and benefits of each option and develop a treatment plan that's right for you.
Now look at question 26. You hear a nurse called Mihiraa talking to a nursing manager. Now read the question.
Nurse manager, I'm concerned about Mr. Adams' behavior. He's been verbally abusive towards the staff, and it's affecting our morale.
I'm sorry to hear that, Mihiraa. Verbal abuse is unacceptable, and we won't tolerate it.
I've tried to address the issue with Mr. Adam, but he continues to be disrespectful. I'm worried about the safety of the staff and other patients.
That's a serious concern. We need to take immediate action to protect our staff and ensure a safe environment for all patients.
I believe we should document all incidents of abuse and report them to the appropriate authorities. We also need to have a conversation with Mr. Adam to address his behavior and set clear boundaries.
That's a good plan, Mihiraa. We'll document the incidents and schedule a meeting with Mr. Adam to discuss the consequences of his behavior. If the abuse continues, we may need to involve the patient's family or consider other measures. Now look at question 27. You hear a dentist called Mihiraa talking to a nurse. Now read the question.
Team, I'd like to discuss the importance of effective appointment booking. It's crucial to ensure that patients are scheduled at appropriate intervals and that our appointment slots are utilized efficiently.
That's a great point, Mihiraa. How can we improve our appointment booking process?
One way is to ensure that we're capturing accurate patient information, including their contact details and insurance information. This will help us schedule appointments efficiently and avoid any delays.
We'll make sure to double-check this information for every patient.
Another important factor is to consider the complexity of the appointment. For example, a routine checkup might require less time than a complex procedure. We need to allocate appropriate time slots for each type of appointment.
That's a good reminder, Mihiraa. We should also be mindful of any special requests or accommodations that patients may have.
Exactly. By considering all these factors, we can optimize our appointment scheduling and minimize patient wait times.
Now look at question 28. You hear a pharmacist called Mihiraa talking to a patient. Now read the question.
Mr. Harry, here's the over-the-counter antimicrobial cream you requested. Remember to apply it as directed and follow the instructions on the label.
Thank you, Mihiraa. I'm hoping this will help clear up the skin irritation.
It should provide some relief, but it's important to monitor the area for any signs of worsening or infection. If the symptoms persist or worsen, please consult a healthcare professional.
Is there anything else I should be aware of?
Avoid applying the cream to broken or irritated skin. It's also important to avoid contact with your eyes or mucous membranes. If you experience any adverse reactions, such as redness, swelling, or itching, discontinue use and consult a doctor.
I'll be sure to follow those precautions. How long should I use this cream, Mihiraa?
The duration of use will depend on the severity of the skin irritation. Follow the instructions on the label or consult a healthcare professional for specific guidance.
Now look at question 29. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Harry, I'm concerned about Mr. Adams' condition. His blood pressure is dropping, and he's becoming increasingly lethargic.
Yes, Dr. Mihiraa, I've noticed those changes as well. His oxygen saturation is also low.
We need to act quickly. Let's prepare to intubate him and place him on mechanical ventilation. We'll also need to administer 4 fluids and vasopressors to support his blood pressure.
I'll gather the necessary equipment and notify the respiratory therapist. Should we contact the intensivist?
Yes, please inform the intensivist immediately. We'll need their expertise to manage Mr. Adams' critical condition.
I've contacted the intensivist. They're on their way, Dr. Mihiraa.
In the meantime, continue to monitor Mr. Adams' vital signs closely and be prepared to assist with intubation.
Now look at question 30. You hear a nursing manager briefing the duties of each nurse. Now read the question.
Team, due to the recent natural calamity, we're facing an influx of patients. It's crucial that we work together efficiently to provide the best possible care. I've assigned specific duties to each of you based on your expertise and availability.
I'm ready to assist in the triage area, Mihiraa.
That's excellent. You'll be responsible for assessing patients' conditions and prioritizing care.
I'll be in the emergency department, assisting with patient admissions and procedures.
Great. We'll need to ensure a smooth flow of patients through the department.
I can help in the observation ward, monitoring patients and assisting with medication administration.
That's crucial. We need to ensure patients receive timely care and medication.
Mihiraa, what about the patients who are currently in the wards?
We'll need to prioritize care based on the severity of their conditions. Some patients may need to be transferred to other facilities if necessary. That is the end of Part B. Now look at Part C.
Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a neurologist Dr. Mihiraa and an interviewer. Thank you for joining us, Dr. Mihiraa. Your research on Creutzfeldt-Jakob disease, CJD, has been gaining a lot of attention recently. Could you start by explaining what the primary focus of your study is?
Absolutely. The core focus of our study is to understand the neuropathological mechanisms that underpin Creutzfeldt-Jakob disease, a rare but rapidly progressive neurodegenerative condition. Specifically, we're investigating how prion proteins misfold in the brain and cause a cascade of damaging effects. CJD is part of a group of diseases known as transmissible spongiform encephalopathies, and prion, the misfolded proteins, are unique in their ability to replicate without nucleic acids, unlike viruses or bacteria. We're trying to map out the cellular pathways that prion disrupt, including synaptic failure and neuroinflammation, while also examining potential genetic predispositions. There's also an epidemiological aspect where we assess clusters of the disease, which may provide clues about environmental or hereditary risk factors.
That sounds incredibly complex, Dr. Mihiraa. How did your study initially begin? Was there a specific event or discovery that launched this research?
The study actually began with a somewhat serendipitous discovery. A few years ago, during routine autopsies of CJD patients, we noticed distinct patterns of neuronal degradation that hadn't been well documented before. This led us to hypothesize that there might be certain previously unknown genetic mutations that predispose individuals to CJD. We initially started with a cohort of familial CJD cases, where patients had a clear genetic linkage, and expanded the study to include sporadic cases. One of the study's early stages involved collaborating with geneticists to sequence the genomes of patients to identify mutations. Then we combined this genetic data with neuroimaging techniques like diffusion-weighted MRI to correlate specific brain changes with genetic markers. The interplay between genetic anomalies and the prion protein's misfolding is what triggered our deeper dive into understanding the disease's mechanisms.
I imagine there must be significant challenges associated with studying such a rare and complex disease. Dr. Mihiraa, what has been the most difficult aspect of conducting this research?
You're absolutely right, the challenges have been substantial. First, the rarity of CJD makes it difficult to gather a large enough sample size for statistically meaningful conclusions. Sporadic CJD, the most common form, affects only about 1 person per million per year. Another major challenge is that the disease progresses so rapidly that, often, by the time it is diagnosed, there's little time to study its full progression in living patients. Brain biopsies are risky and often not an option. Moreover, prion are notoriously difficult to work with because they aren't destroyed by conventional sterilization methods. This poses both biosafety risks and technical hurdles in handling and analyzing samples. We've had to implement very stringent laboratory protocols to ensure safety and prevent contamination. Additionally, the lack of effective animal models for prion diseases complicates translational research. Replicating human prion diseases in animals has limitations, so our models don't fully mirror the human condition.
Despite these challenges, I've heard that your team has made some important progress recently. Could you share the latest developments from your research, Dr. Mihiraa?
One of the most exciting developments has been in identifying early biomarkers of CJD. Through our use of advanced neuroimaging techniques, we've started to detect specific changes in brain tissue that occur before clinical symptoms emerge. These findings are significant because they could lead to earlier diagnosis, which has always been a challenge with CJD. In tandem, we've been investigating novel therapeutic agents that can potentially interrupt the prion replication process. We've also developed a new in vitro system that allows us to study prion propagation in human-derived neurons, bypassing some of the limitations of animal models. This system has opened the door to high-throughput drug screening, where we're testing various compounds that might prevent prion misfolding or reduce neurotoxicity. Furthermore, recent collaborations with other international prion research groups have led to the discovery of a possible immune response pathway that could be targeted to slow disease progression. It's a very dynamic time for this field.
That sounds very promising, Dr. Mihiraa. What are the expected outcomes of your research, both in the short and long term?
In the short term, we aim to refine our understanding of prion biology and develop more reliable diagnostic tools for CJD. If we can identify biomarkers that are detectable early in the disease process, it could drastically change how CJD is managed. Early detection could give patients and families more time to plan and could open up opportunities for interventions that might extend survival or improve quality of life. Long-term, we hope our research will lead to effective treatments or, at the very least, therapies that can slow disease progression. Although we're still far from a cure, our study is building a foundation that future research can expand upon. We're also exploring the broader implications for other neurodegenerative diseases like Alzheimer's, which share some mechanistic similarities with prion diseases. We believe that by understanding prion diseases more deeply, we might unlock new approaches to tackling a wide range of neurodegenerative disorders.
It's clear that the potential impact of your work could be far-reaching. Dr. Mihiraa, how do you envision this research affecting the medical field and the public at large?
The impact of this research could be transformative. If we succeed in developing early diagnostic tools for CJD, it could become a model for diagnosing other rapidly progressing neurodegenerative diseases. Moreover, by understanding the prion replication process, we could pave the way for therapies that target similar mechanisms in conditions like Parkinson's or Huntington's disease. On a more immediate level, our research could help doctors differentiate CJD from other forms of dementia, which is often misdiagnosed, giving families more accurate information. Finally, from a public health perspective, there's always the concern of prion diseases crossing species barriers, as we've seen with mad cow disease. Our research could help inform policies on food safety and the handling of prion-contaminated materials in medical settings. In sum, while CJD itself is rare, the ripple effects of prion research could extend far beyond this one disease.
Now look at Extract 2. Questions 37 to 42. You hear an oncologist, Dr. Haydn Joe, talking about the unforgettable journey in his career. You now have 90 seconds to read questions 37 to 42.
Today, I am honored to share a case that deeply resonates with me, both as a professional and a person. It's about a patient named Mihiraa, a young woman whose life took an unexpected turn after a severe accident. My involvement in her cosmetic dentistry treatment has left a lasting impact on my career, primarily because of the unique challenges involved in restoring not only her smile but also her confidence. Let me walk you through the multifaceted nature of this case, touching on both the technical and emotional aspects of this life-changing process. Mihiraa's case stands out not only because of the complexity of the cosmetic work but also due to the emotional depth of the situation. She came to me following a traumatic accident that resulted in severe dental damage. What made her case memorable was not merely the damage itself, but the fact that she was a vibrant young woman who saw her self-confidence plummet overnight. As a dentist, I'm accustomed to addressing physical issues, but this was different. This was about rebuilding a person from the inside out. The look of despair in her eyes, coupled with the urgency of her case, made me commit myself entirely to restoring not just her teeth, but her sense of self. Cosmetic dentistry often involves more than just technical expertise, it involves empathy, and that is what anchored Mihiraa's case in my memory. The way she communicated her emotional distress over her appearance made me realize that our work as dentists can significantly affect someone's mental and social well-being. So, the stakes here were more than just oral health, it was about rehabilitating her identity. Mihiraa's accident had left her with extensive damage to her front teeth, gums, and jawline. The challenge here was not just in the physical reconstruction but in ensuring that the end result would look and function naturally. A mere restoration wouldn't be sufficient. I had to guarantee that her teeth would look aesthetically pleasing while being durable enough to handle day-to-day functions like chewing and speaking. Another layer of complexity involved the timing of her treatments. The damage was so severe that immediate cosmetic fixes were not an option. We had to focus on reconstructing the foundation first: dental implants, soft tissue recovery, and jaw alignment, all while managing her expectations. Patience was critical, both for her and for me. I opted for a phased approach, knowing that rushing through any part of the process could compromise the outcome. This involved several consultations with other specialists and constant reassessments of Mihiraa's progress. At every step, there was an element of unpredictability, especially concerning how well her body would respond to each treatment phase. Support in cases like Mihiraa's goes beyond the clinical realm. Apart from the dental procedures, a significant part of the process was to help her emotionally navigate the situation. Before we began, I spent hours consulting with her, discussing potential outcomes and what she could expect at each phase of treatment. I needed her to trust the process, which wasn't going to be quick or easy. This emotional support was essential in helping her stay resilient through the lengthy treatment phases. My support didn't stop with our interactions. I made sure she had access to additional resources, including counseling services to deal with the trauma of her accident and the body image issues that came along with it. I also arranged regular follow-up appointments to track her progress. Even when her active treatment was completed, I scheduled long-term reviews to ensure the success of the procedure over time, as well as to check on her emotional recovery. A case as complex as Mihiraa's required collaboration with various specialists. From oral surgeons to orthodontists, periodontists, and even psychological counselors, a multidisciplinary approach was essential for a holistic recovery. The initial oral surgeries required detailed coordination with the orthodontist to ensure that any alignment work would support, rather than complicate, future cosmetic restorations. Similarly, I worked closely with the periodontist to make sure her gums were healthy enough to sustain the extensive work we had planned. Constant communication among the team was key. We held multiple case discussions to align on the timing and approach to each treatment. This synergy ensured that no single treatment jeopardized another and that we maintained a consistent vision for the final outcome. Each member of the team played a role, and the success of the entire procedure was a testament to this collaborative effort. After months of careful treatment, Mihira's smile was fully restored. The transformation was not just physical but emotional. Her once broken teeth were replaced with custom-designed veneers and implants that restored her functionality and gave her back the confidence to smile. The materials we chose were state-of-the-art, ceramic veneers designed to reflect light in the same way natural teeth do. Her teeth not only looked aesthetically pleasing, but they also functioned perfectly. Mihiraa was overwhelmed with the results. Seeing her joy at the end of this arduous journey made every challenge worth it. This was more than just cosmetic dentistry, it was a life-altering transformation. The technical success was undeniable, but the emotional and psychological impact was what made it all truly worthwhile. Reflecting on Mihiraa's case, I can say it marks a defining moment in my career. The case wasn't just about skill, but patience, collaboration, and empathy. It tested my technical abilities but also reminded me that the work we do as dentists extends beyond the physical into the emotional and psychological realms. Mihiraa's journey taught me that cosmetic dentistry can change lives, not just appearances. I find myself carrying this lesson into every case I handle now, particularly those that require a more nuanced approach. The successful coordination with a multidisciplinary team, the meticulous planning, and the emotional support provided to Mihiraa highlighted what modern dentistry is truly capable of achieving.
That is the end of your OET listening test. Now check the answers.